I'd like to ask, I understand that there were 14 cases added to Acacia Home yesterday. So even when we consider the cases there are actually very few community cases in Singapore. So I'm just wondering, does this mean that we can expect our tightened circuit breaker measures to end by May 4th?
We've said that we will monitor the community transmission very carefully and look at the numbers daily. The trend is indeed improving, but we want to be sure that there is a decisive reduction in local community transmission before we make any moves to relax the circuit breaker measures, be it on May 4th or after that. Right, so we are still watching over the next few days how the numbers will pan out and unfold, and then we will, as we review the situation, we will decide whether or not there is scope for some easing. I should add that the numbers are what they are, but the numbers that we see every day are sometimes also a result of the extensive testing that we do. And we are ramping up testing. We have been doing this extensively. We've reported this, or we highlighted this yesterday, and we said that we are also going to be doing more testing, particularly in vulnerable areas across our nursing homes, for example, the residents, the staff of these nursing homes. As we do these active testing and sweeping of cases, I would not be surprised if we find more cases. This sweeping of this active testing, active case finding, I will not be surprised if we see more cases popping up. These are what they call cryptic or hidden cases, because these are people with very mild symptoms, maybe even no symptoms at all, but they are in the community. They may be self-medicating, thinking that it's just a mild cold and I take a Panadol or I take some flu medicine and it's okay, I rest and it's all right. So there may very well be cases like that in the community, which we are not detecting. They are not presenting themselves in the system. They are not going to see a doctor, right? And when we do an active sweep in a particular institution, we may well find more cases. So we will continue to monitor. We will continue to ramp up our testing as we've said we will. And then if the situation permits, if the numbers do indeed come down, we will look at relaxing some of the restrictions.
Perhaps I should add that we do intend to step up our screening, especially for nursing homes and for the vulnerable elders and the seniors in the senior homes. And these 14 cases was actually the result of a comprehensive screening of the Acacia home. And that's why we found these 14 cases. Had we not screened them, we probably would not have discovered them. And in time to come, some of them may fall ill and then we'll discover later. But what it means is, as Minister Wong pointed out, as we step up our screening and testing of these vulnerable seniors, you are likely to expect to see more cases being detected, which otherwise would not have been detected if we do not do the screening. And these cases will emerge over the next few days as we step up our screening and testing efforts among these vulnerables. So I think we need to be prepared to see more cases emerging from these institutions as we do proactive screening tests for them.